The annual Bridge Walk for Autism returned to Grand Rapids Blue Bridge Thursday evening. More than 2,000 people showed up to help raise awareness about the condition as part of National Autism Acceptance Month. The walk has since wrapped up, but we're anchoring our show from the Blue Bridge to discuss the diagnosis and how it impacts families. The condition is making headlines this month after the CDC released a report about the growing number of autism diagnoses, along with recent comments made by Health and Human Services Secretary Robert F. Kennedy Jr. During his first news conference as the head of HHS, RFK made several controversial claims, calling the rising autism cases an epidemic. He also announced the launch of a testing and research effort to determine a cause. CDC data shows an estimated 1 in 31 U.S. children have autism. Health officials are largely attributing the growing numbers to better recognition of cases through wide screening and better diagnoses. To get another perspective on the CDC's data, I spoke with a child and adolescent psychiatrist to address the conversations happening nationally.
Psychiatric disorders over many generations have found their way into the political sphere, and right now the sexy topic seems to be autism.
Dr. Elizabeth Wielgus, a child and adolescent psychiatrist with Health West, says what's happening with autism is a resurgence of something old and something that's easy to focus on and can be divided.
Now, it worries me because this has implications for very real patients and families, and so I'm hopefully here to share a little light on what this really is, to support those patients who really have autism and their families.
There are a few things she hopes to make clear.
I mean, I think the most obvious thing, and I don't think you'll be surprised in me sharing, is that vaccines very much do not cause autism. What I want people to realize is autism spectrum disorder is a part of an individual's story, but there's so much more to them. It's just one aspect of their life. And it's true, some maybe require more supports, but others really don't, and are very much just your average person trying to live their life.
The recent rise in autism, according to the CDC, she says can be attributed to an increase in awareness and knowledge. And there's much more nuance to the disorder than what you may see in national headlines.
The symptoms are hardly ever the same for any two people. Moreover, it's a spectrum in terms of, like you said, severity.
And there's 3 levels to autism diagnoses and a difference in how they are treated.
Some individuals just have an individual therapist, like many of us do in the community, and some individuals warrant treatment with a medication. I will say there is no medicine for autism, and usually we focus on symptoms.
Thursday's Bridge Walk was hosted by Hope Network, a healthcare provider that specializes in autism evaluation and treatment. The nonprofit opened Michigan's first all-inclusive treatment center in 2011. There are now 4 locations.